Hello, here is how I learned senile vaginitis. Senile vaginitis is also called atrophic vaginitis. The new term is genitourinary syndrome of menopause. It is typically seen in postmenopausal women. Let's see the pathophysiology. In these women, there is reduction in the level of estrogen. Because of decreased levels of estrogen, there will be decreased cervical discharge. This reduced cervical discharge causes dryness of the vagina. This is the most important point in this whole topic, that is, it causes dryness of the vagina. Let's look at the symptoms. Now we can group the symptoms into two groups. The first group is urinary symptoms, and the second group is genital symptoms. Genital symptoms are dyspareunia and bleeding PV. This occurs due to atrophic vagina. The urinary symptoms are increased frequency of urination, dysuria, frequent UTI, and urinary incontinence. Let's look at the examination. The local examination shows three significant findings. The first finding is shiny vaginal mucosa. The second finding is loss of vaginal rugosities. The third finding is thin and atrophied vaginal mucosa. Thin and atrophied vaginal mucosa. Let's look at the management. As we have seen about that, the symptoms arise due to dryness of the vagina. Therefore, the first line management will be vaginal lubricants. Next, the second line management will be local estrogen therapy because the cause was reduced estrogen levels. Local estrogen therapy can be given in these forms. That is, we can give it as a cream, gel, pessary, or ring. We can also use some SERMs, that is, selective estrogen receptor modulators. The SERMs that can be used are ospemifene or bezidoxifene with estrogen. Next, there is one important point that we should remember here, that there are some SERMs that cause vaginal dryness, and these are very commonly used SERMs also. Therefore, it is an important point. These SERMs are clomiphene, tamoxifen, and raloxifene. That's all about atrophic vaginitis. So let me sum up atrophic vaginitis for you. So a case of atrophic vaginitis will typically be a woman who is in a postmenopausal phase. She will have reduced estrogen levels that will show dryness of vagina and symptoms that can be genital and urinary. Therefore, it is also called a genitourinary syndrome of menopause. Thank you.